Hi everyone, this is Dr. Stefan. In this video, I'd like to talk a little bit about a comment about asthma treatment that I received on my channel. So I think if you suffer with asthma, this is just something to highlight that there can be communication issues between you and your doctor or someone you care for who has asthma, and they're seeing a doctor, they're being prescribed a treatment, they have some potential side effects. And then the communication breakdown happens, and people are left without treatment, sometimes because of confusion rather than anything else. So let me just quickly go to the comment, because I think you may find this interesting. So Sabina is asking that my mother, who is 60-year-old and she has heart problems for years, was diagnosed with asthma in November this year. She started taking Foster inhaler, Singular, and Tamales. So Foster is an inhaler which is commonly prescribed for asthma. It's a combination inhaler, inhaled corticosteroids and bronchodilator. So that's a combination of two medications. Now Singular is also called Montelukast, and it's also a medication in a tablet form that's commonly prescribed for asthma. And then Tamales is a medication that's an antihistamine. So sometimes it can be prescribed for allergic asthma. Now, basically, let's read on. So after a week, she started having dizziness with short periods of darkening of vision, which is, again, something quite worrying. So, may or may not be related to the medication. A month later, she went back to her doctor, and the doctor told her that she must not take any medication for asthma because all asthma medication has corticosteroids, and these corticosteroids affect the heart. So this is completely wrong. Okay, so this is we'll go back to that. So the doctor also told her that she has no other variant option for treatment. Now, we have an appointment with another doctor in January. So because she needs some sort of treatment. I agree. So if someone has asthma, they probably need some form of treatment. Now, this is usually a good treatment regimen for asthma. So, having the inhaler, some tablets that, challenge the inflammation and things like that, prevent these sort of asthma attacks. However, this is something that I believe was the wrong communication. Sometimes certain inhalers, such as Foster, they have a bit of a stimulant effect on the heart. And in someone who has heart problems, they may sometimes experience some side effects. They could be from the inhaled medication, right? So this is something that's really, really important, right, to consider. Now, dizziness and short periods of darkening of vision, of course, that's something really worrying, but it can be related to the heart problems, whether that's to do with the rhythm disturbance of the heart, something else that's going on. Maybe this heart condition is not really treated properly. So there's a lot of nuances in these sort of cases. Now, obviously, I'm not your doctor. I'm not trying to say how you should be treated. But this is, I believe, the wrong communication. The corticosteroids in the inhalers are at such a low dose that they're unlikely to affect the heart. It may be that the stimulant medication in the Foster could be causing a side effect. That's possible. It could be a reaction to one of these medications. So there's quite a lot of things going on, but a low dose inhaled corticosteroid to treat asthma is actually a very, very safe option. And treating the asthma that way prevents attacks, which can cause further heart problems as well. So it's really, I believe here the communication wasn't correct, in the sense that maybe the doctor was referring to some other medication contained in the inhaler, not the corticosteroids. The corticosteroid is an anti-inflammatory drug. It's taken in very, very low doses in inhalers, and they control the inflammation in the airways, right? So that's all that it does. I would say the vast majority of cases, most people have no problems taking that type of inhaler if they have asthma. So again, I believe that here, this is an exaggeration, because inhaled corticosteroids shouldn't be affecting the heart. There may be other things going on. So maybe we don't start with all three medications at once. In these cases, we tend to then introduce medications slowly, one by one, to try to control the asthma while treating the heart problem as well. So it's a very complex situation, but I just wanted to highlight this question because it's really, really important to understand that asthma is an inflammatory condition of the airways. Taking bronchodilators, which are stimulants, generally doesn't by itself control the asthma. It actually leads to more risk. So taking low doses of inhaled corticosteroids controls the inflammation in the airways. Those doses are generally so low that they don't get absorbed in the rest of the body, so it causes very little to no side effects. So this is the beauty of inhalers, because they really help control major conditions with minimal medication. Now, in these cases, when there are other conditions at play, we generally don't start with maybe combination inhalers. We start with just the inhaled corticosteroids, and we have inhalers such as Stanel, for example, which is helpful in these situations because it's just inhaled corticosteroids. There are others as well. And then we may add medications as we go along. If the person continues to be stable and we need more treatment for the asthma, we add a bit more. We add a new tablet, we add things like that. But we need to always be mindful of interactions with heart medications, with other things that are going on. So complex situations that people are highlighting in the comments. Like I said, I'm not your doctor, I don't know the case, but it seems unlikely that the corticosteroids are the ones causing the problem here. And I think it was just the communication that was not efficient in this regard. So always try to ask a lot of questions when you see your doctor about your asthma treatment. And if you're experiencing any side effects or any problems when you start a new medication, try to talk to your doctor to see whether it's indeed the medication causing that, because you might be left without treatment for a miscommunication. So it's really important to clarify everything, to make sure that everything's in the right box. You understand why you're taking the medications that you're on. And some people may have huge lists of medications, especially as they're getting older. They may accumulate a lot of medications from different specialists. They may interact with each other. They may not know why they're taking this or that medication. It's really important to be clear and clarify why you've been prescribed certain medications, because then you can really understand the reason for any side effects that appear. And we can only eliminate the medications that are causing the side effects while keeping the ones that are actually helping. Hopefully this was a good perspective, and I hope you'll ask further questions in the future if this isn't clear. Go talk to your doctor, clarify the situation always if you're worried. Hope this was helpful. All the best and good health.